Hi everyone. I'm gonna go over clinical vignette part 1, and I apologize for the video not working yesterday. Tech issues. What can I say? So let's jump into part 1 of the vignette. You'll also benefit from taking a good look at the outline that I posted under announcements about a week and a half ago. Check that out. That's also where the sample biopsychosocial assessment is. But a couple of reminders about this paper. You are required to follow APA format. It is due Sunday by 11:59 p.m. Week 4, so next week. So let's go over the outline here as well, and I will just talk you through some of the formatting and how to answer the questions thoroughly. Okay, so of course, introduction, explain your role with the client and the context in which you work with the client. So when you explain your role with the client, in what way do you interact with the client? Are you their therapist? Do you work in a community behavioral agency? Are you their case manager? Are you their therapist at the agency? What role do you work with them? And it's okay if you're not the therapist or the clinician, just explain your role with the client and in the context of your work with the person. So, of course, it's clinical work if you're acting in a clinical role. If you're the case manager or if you're their advocate, let's say, you just want to explain the context in which you work with the client. I will say, if you have any questions about this part, reach out to me ASAP, because you do want to make sure that the person that you have in mind will work for this paper and part 2 of this paper, right? So you want to make sure that you can provide the information that's needed, and you can ad-lib some of the information as long as it makes sense and it's answering the questions, okay? So identify the data source for the report, data sources rather. You want to explain where you're gathering your information. So the client has a chart that was transferred over from their previous treatment center. Identify if they're coming to you for, court mandated, so you have those records. Explain why you're working with the client, like where they're coming from. So like in a drug and alcohol clinic, the person may be referred from inpatient or court or children and family services. Those would be the referral source, and then the data source is where you're getting the information. So perhaps your own intake with the patient compared to a previous biopsychosocial or discharge summary that you received from the referring source, okay? List the identifying information. This paragraph is self-explanatory, but I do want to just add that you want to make sure that you're answering all of these parts. These are the demographic information parts. Of course, with name, don't use an actual patient's name, use an alias, and if there's information that you are not aware of. So for education, you might put, to the best of my knowledge, the patient completed 10th grade and at this time has not obtained a GED. At this time, the patient has no college experience. That would be answering the education portion. If there are portions that are unknown, you want to identify any missing information. So if the relationship status, for instance, if you weren't aware, you would put it's unknown if the client is currently in a relationship. We want to just state that information, okay? So for presenting problem, you want to give a concise description of the problem that the patient is presenting for services, okay? So why are they coming to see you or your agency to obtain services? Like, that's the problem. And then when you come down to chief complaint, you want to state, preferably in the client's own words, a sentence or two why they feel they are there. So for example, a person could be coming to you to complete a requirement. That could be the reason why they feel they're there receiving mental health services. But the actual true problem could be the person may be, yes, completing a requirement, but they may also be under investigation for like child welfare. If they don't address the ongoing drug addiction, they're in danger of losing custody of their children, right? That could be one example. Another example could be a family, a spouse or family collectively has decided that if a person does not complete an entire treatment episode, that the spouse may leave them or the family may cut them off financially. Like, you want to state the chief complaint that the client states, like their perception, but then the actual perception based on your information. Okay, makes sense? Okay. Next, describe the history and context of the problem situation. So you want to just give a brief history on what brings the client to services, and the context, you want to just describe like what's happening. So this depends on like why your client is there, right? So if your client is coming to you for the purpose of this paper, and you're saying you're in private practice and they were referred to you because of the type of work that you do, perhaps addictions or trauma work, you would explain like a brief history of the client's past, like challenges, right? So you may explain like this person is currently in their early 40s. They had a decent childhood, they went to college, they graduated, they obtained employment, but they've had trouble in relationships, like maybe never married or a failed marriage, and perhaps there were a situation, maybe the divorce or a career setback that has triggered kind of old trauma to come up for them. And now they're really having great difficulty functioning at the level that they want to be functioning, right? That could be one example of a history. And you could give a bit more detail than that, but that's like the bottom line, right? And so they're coming to you to really do some trauma work, to work on their attachment style, to make that healthier so they can have healthier, long-standing relationships and learn how to relate to themselves better, right? And you also, a different example could be like a patient's coming to you for long-standing depression, let's say, but you also learn during the assessment process that maybe they are 8 or 10 years sober from drugs or alcohol, and that contributed to a lot of their symptoms, but they are sober now and they are having symptoms again, that are not well managed. So they're coming to you for like some psychoeducation, some medication management. So they'll be working with a psychiatrist, but you want to explain maybe the history. So what led to the addiction, briefly about the addiction and recovery, and kind of where they are now. That would be a history and a context, right? And so you want to go over the brief history of psychosocial factors and family history. And again, on the outline that I provide under the announcements, I go over suggested links for each of these sections, like a paragraph or two. That's listed there. For this section here, psychosocial factors, it could be anywhere from 2 to 3 pages. I mean, it could be 4 pages, but the max of this paper is 12 pages. You want to be careful not to go over that. I will send it back to you to edit, and this paper should not be less than 5 pages. If it is, I'll also send that back for you to rewrite that. So when you list this brief history, you want to go into, again, like the biological, social, psychological, and environmental factors here, but you don't have to write a soap opera. If you have any questions about that, let me know. Develop a list of current diagnoses and include current medications. Self-explanatory, but again, you should be using only DSM-5 diagnoses, and if you look up the diagnoses, you can Google them. There will be suggested medications for the diagnosis to use for this paper, just for the terms of this paper. When it comes to state whether or not you agree or disagree with the person's current diagnosis, that's very clear. This is where you're going to put your clinical impressions of if you feel the patient's behavioral manifestations are matching the current diagnosis, right? Why or why not? Then you want to assess if you feel the DSM-5 diagnoses are related to substance use disorder, symptoms, trauma, or anxiety, right? So you want to share if like there's underlying issues going on there, right? Usually when it comes to addictions work, there's usually underlying trauma. There's usually underlying like mental illness that contributed or sometimes can be a result of the substance use, right? So you just want to make sure that you answer this question thoroughly. And I also want to encourage you to use the rubric to write this paper. I use the rubric to grade this paper. The only other section that I want to comment on is, again, the presenting problem section. You want to make sure that you answer these questions in depth. It will help you form the section of the paper. Also, under presenting problem, make sure that you answer these questions. It's going to guide this section of the paper, and it will also inform how you think about these questions for future assessment in your work in this class and in your actual practice. Again, make sure that under your view that you really are transparent with this. It will help you. And under current diagnosis, also, if you enter these, this can be in a list, doesn't have to be in sentence form, though it can be. And under signs and symptoms, you really want to answer these questions thoroughly. And so, A through E, right? So A, define the challenging behaviors, answer that thoroughly. B, state whether the signs and symptoms match and are related to underlying issues such as substance use disorder or PTSD. C, make sure that you really get clear about this and reach out to me if you have questions. You want to define 2 or 3 possible differential diagnoses. using the behavioral manifestations that you list in this paper about your patient, right? So those behaviors must match the diagnosis that you're suggesting. You want to give a rationale for each of your suggested diagnoses, and then you want to also describe if you have ruled out any diagnosis. So for instance, if a patient presents with having like possibly schizophrenia, but you rule that out because you feel that it really is PTSD with a possible mood or adjustment disorder, you would just state that here, okay? Again, adhere to APA format. Make sure you use headings where necessary, that you have your title page and reference page. And if you have any questions about the DSM-5 section of this paper where you're getting into your diagnosis and you're setting that up, please reach out to me as soon as possible so I can get back to you and we can talk about it if you need further clarification. Any questions at all, please reach out. You guys are going to do well. I thank you for your time. Have a great day, guys. Bye.